Hello everyone. Let me first introduce myself. This is Dr. Hamouda Wannasa. I am an associate professor of parasitology mycology at the Department of Medicine, University Batna Algeria. Today, in the 34th World Summit on Immunology, Microbiology, Women Health and Nursing, May 15 to 16, 2023, I'm going to present my work entitled Study of Risk Factors for Oral Candidiasis in Diabetics. Diabetes mellitus is one of the most prevalent endocrine disorders, signified by the presence of long-lasting hyperglycemia. It is the cause of many infectious manifestations and complications such as dry mouth, taste disorders, oral candidiasis, rhinocerebral zygomycosis, mucormycosis aspergillosis, geographic tongue, oral lichen planus, delayed hearing, periodontitis, gingivitis. Yeast infections are common in diabetic patients. Oral candidiasis is one of the most common fungal infections affecting the oral mucosa. Previous studies have demonstrated that the saliva of people with diabetes contains a higher amount of candida colony forming units compared to the saliva of healthy subjects, due to various factors such as reduced salivary flows, higher concentrations of salivary glucose, a decrease in the host defense system due to reduced neutrophil activities, and a greater addition of Candida species to all epithelial cells. The risk factors for oral thrush are complex, but tongue damage, smoking, alcohol consumption, wear dentures, taking medications, and immunosuppression such as diabetes are known to be factors clearly influence oral candidiasis. Given the frequency of oral candidiasis in diabetic patients, we were interested in studying them through this study, which took place in the University Hospital Center of Batna, Algeria. Our main objective was to describe the epidemiological characteristics of oral candidiasis in diabetics hospitalized in various departments, and as secondary objectives, determine the risk factors for the occurrence of oral candidiasis in diabetics, describe the different fungal species isolated, establish a strategy for the proper management and prophylaxis of oral candidiasis. Materials and methods. It is a cross-sectional descriptive prospective study took place in the University Hospital Center of Batna, Algeria, based on the observation of the buccal-dental state, particularly of the oral mucosa, and the evaluation of the frequency of oral mucosis and the risk factors involved in the occurrence of these diseases in hospitalized diabetic patients of different ages over a period of 5 months from November 1st, 2021 to March 31st, 2022. Data collection was made from fact sheets that contain general and specific information about oral thrush. After a thorough examination of the entire oral cavity, a swab was taken using sterile swabs from the tongue, the inner face of the cheeks, the soft palate, or an identified lesion. The samples were taken preferably on an empty stomach in a sterile manner. Under sterile conditions, the samples were cultured in Saburo medium supplemented with chloramphenicol to finally be incubated in the oven at 37 degrees Celsius for 24 to 48 hours and up to 1 week. A positive result is revealed by the presence of creamy white colonies, a few millimeters in diameter, with shiny smooth surfaces and sometimes dry, dull, or wrinkled. Species identification is based on the use of the Oxacolor kit. Results and discussion. During the study period, 78 diabetic patients were included in our study, including 49 patients with a positive culture. The prevalence of oral candidiasis in our patients was 63%. This result is very close to that found in the study by Belazzi and al. In 2005, who found a frequency of 64% of oral candidiasis in diabetic patients and 40% in healthy subjects. Another result is that of Mohamdi and al. In 2016, who found a 55% frequency of oral candidiasis in diabetic patients. The age group of 0 years to 15 years was the most represented with 40% of cases. Our result is far from that found by Adriato Wallet Hamed Salah during a study on the epidemioclinical aspects of the lesions of the oral mucosa in 266 diabetic patients at the Mali Hospital in 2019, where the age group between 10 years to 25 years was the most representative with a frequency of 43% of cases. We noticed the predominance of the male sex, 41 men or 53%, compared to the female sex, 37 women or 47%. In our study, the male gender was the most represented at 53%, results close to that of the study by Mohamdi and al. In 2016, which showed that 65.5% were male. This can be explained by the lack of hygiene, toothbrushing, tobacco consumption, and during our study period we met more men hospitalized than women. Distribution of patients according to hospitalization services. The majority of patients were hospitalized in the pediatric department with a frequency of 40%, followed by the internal medicine department with a frequency of 31%. The lowest frequency was recorded at the orthopedic and traumatology department, 9%. Our study revealed that the frequency of positive cases of oral candidiasis is higher than negative cases of oral candidiasis, whatever the department. Of the 49 patients with oral candidiasis, 73% had not consulted a dentist for a long time. We noticed that 59% of cases of oral candidiasis were related to type 2 diabetes. Of all the patients with proven oral candidiasis, 90% had unbalanced diabetes with disturbed blood sugar levels above 1.26 gram L. The distribution of positive cases according to the reason for hospitalization, diabetic ketoacidosis and acute coronary syndrome were the most common reasons for hospitalization in our patients, with a frequency of 39% and 20% respectively. The other reasons for hospitalization, diabetic foot, digestive hemorrhage, fracture and trauma, hepatic disease and thrombosis, present almost equivalent frequencies. Kidney disease was the least common reason for hospitalization. The most observed clinical forms are acute pseudomembranous, 12%, thrush, oral aphthysis 12%, yellowish tongue 9%, and fissured tongue 6%, geographic tongue, black villus tongue, and angular cherets represent a rare form in our studies. The distribution of positive cases according to the treatment received. Among diabetic patients with oral candidiasis, 42 of them use insulin therapy. Other patients take oral antidiabetics either alone or in combination with insulin therapy. Cardiological drugs, anticoagulants, and antibiotics are among the drug classes most consumed by our patients. Distribution of patients according to the class of antibiotics consumed. 21 patients were under antibiotic therapy. Beta-lactams were the most used class of antibiotic, 67%. The distribution of positive cases according to risk factors. The most incriminated risk factor in oral candidiasis was antibiotic therapy with a frequency of 26%, followed by diabetic ketoacidosis with a frequency of 24%, followed by the wearing of dental prosthesis 50%. In our study, we found several factors favoring the appearance of the disease in these patients. The diabetic imbalance, which is one of the important factors involved in the disease, and we have found that 90% of the cases of oral candidiasis affect patients with disturbed blood sugar levels, in addition to the diabetic ketoacidosis, which constitutes the reason of hospitalization, the most more frequent 39%. This was consistent with studies by Horsavi and al. In 2008 and Al-Mubarki and al. In 2013, which stated that the degree of candida prevalence in the oral cavity can be altered by blood sugar levels. This result may explain that a high carbohydrate diet or poor glycemic control in diabetic patients may promote candida overgrowth and increase the production of hydrolytic enzymes such as secreted aspartyl proteases and phospholipases capable of degrading basement membrane. These enzymes not only promote yeast invasion of altered oral epithelium, but also provide direct cytotoxicity and induce mucosal inflammation seen in atrophic or erythematous candidiasis. The use of high doses and long duration of antibiotic therapy was the most common risk factor, mainly during the COVID-19 pandemic, involved in the development of oral candidiasis. In our study, a large number of people consume antibiotics, mainly beta-lactam 67%. A result close to ours was found by Vijay and al. In 2021 in India in a study on secondary infections in hospitalized patients with COVID-19. 16% of our patients presented with angina, hence the need to prescribe antibiotics. The microenvironment of the prosthetic bearing palatal mucosa is low in oxygen, largely devoid of saliva, and has a low acidic pH, which may promote the hydrolytic enzyme activity of Candida virulens, allowing tissue invasion of the host and avoidance of host defense mechanisms. Therefore, the risk of contracting oral candidiasis was significantly higher in diabetic wearing dentures than in those who did not. In our study of an effective of 15 diabetic patients who wear a prosthesis, 80% have oral candidiasis. The distribution of positive cases according to Candida species. We obtained 49 positive cultures. Candida albicans was the most frequently isolated species with a frequency of 37%, followed by the species Candida dubliniensis with a frequency of 27%, and the species Candida tropicalis with a frequency of 18%. Our data revealed that the species Candida albicans was the most frequently isolated from the oral cavity, 37%, which is in line with the results found in the study by Mohamdi and all in Iran in 2016, which found a similar result, 36.2%. Candida albicans has the ability to adhere to the surfaces of mucous membranes and dental prosthesis, which is considered the first step in pathogenesis. The ability of Candida albicans to respond to changes in the host environment can respond to the increase in the number of colony-forming units and invade tissues and cause infections. We have also observed the emergence of the new species such as Candida parapsilosis, Candida lusitania, Candida crassei, Candida glabrata, as well as Cryptococcus albidus and Cryptococcus inegaculatus. Conclusion. Diabetes is a chronic disease considered to be one of the leading causes of illness and premature death in most countries. Oral candidiasis is the most frequently encountered fungal infection in diabetic patients caused mainly by a yeast of the genus Candida. Although Candida is a normal commensal of the oral cavity, many factors can predispose the occurrence of oral candidiasis, such as extreme age, hyperglycemia, immune dysfunction, underlying diseases such as heart disease, hypertension, hepatopathy, dystroidism, infection diseases linked to the increased use of long-term antibiotic therapies, particularly in the event of angina and COVID-19. Insufficient oral hygiene, smoking, long-term use of dental prosthetics, and the presence of dental caries are also contributing factor. Systemic health is linked to oral health, especially in people with diabetes, which increase the need for dental and medical management of the patient. To improve the general and oral health of diabetic patients, a collaborative relationship between patients, pharmacists, physicians, and dentists must be developed.